Hi friends. So in this video we shall be discussing a very important topic of gastric outlet obstruction, where we'll be focusing mainly on the metabolic changes that occur in a case of gastric outlet obstruction. But before moving towards that, let's take a look at few of the causes which I've enlisted over here. The causes of gastric outlet obstruction could be pyloric stenosis secondary to peptic ulceration, acid ingestion, carcinoma stomach, Bezoar's, gastrointestinal stromal tumor, gastric lymphoma, pancreatic mass, annular pancreas, compression due to enlarged lymph nodes, and pyloric mucosal diaphragm. So, what happens in gastric outlet obstruction? So, there is vomiting. Now, because of this vomiting, what happens is there is a phase of chronic dehydration. Now, because of this chronic dehydration, there is loss of hydrogen, loss of chloride, and loss of potassium. Now, this loss of chloride is going to lead to hypochloremic. Now, this loss of potassium is going to cause hypokalemia. Now, what happens because of this loss of H plus ion is that it leads to a state of alkalosis. Now, this alkalosis is a metabolic alkalosis. Now, why is this a metabolic alkalosis? Because over here the lungs are normal. So, this is a case of metabolic alkalosis, as lungs are normal. Now, because of this alkalosis, body tries to compensate or combat the situation. Now, body will try to compensate, right? So now, how this compensation is going to occur? It is going to occur in form of loss, or rather excretion, of bicarbonate through kidney. Now, as this bicarbonate is being lost, along with this bicarbonate, the sodium ions are lost. So, during this, Na plus ions are lost. Now, what is this leading to? This is basically leading to a state of hyponatremia. Now, we very well know that this low sodium ions or a state of hyponatremia is going to ring the bell of a system, which is the RAS system. So there is going to be activation of the renin, angiotensin, aldosterone system. Now, what happens because of the activation of this RAS system? It is going to liberate aldosterone. Now, we know the function of aldosterone. What is it going to do? It is going to cause retention of sodium and water. Now, along with that, it is going to excrete what? H plus and potassium ions. Now, because of this excretion, what is going to happen is urine that is coming out is going to be rich in hydrogen ions and potassium ions. So, what is going to happen? So, basically, it is leading to metabolic alkalosis, hypokalemia, hypochloremia, hyponatremia, and paradoxically, the urine is rich in potassium and hydrogen ion. So we have a final metabolic abnormality, which is metabolic alkalosis with paradoxical aciduria, and to that you can add hyponatremic, hypokalemic, and hypochloremic. So let's take a look at these changes once again. So we have a phase of vomiting. Now this vomiting is going to cause chronic dehydration. Now what is going to happen? There is going to be loss of H plus ions, chloride ions, and potassium ions. So there is going to be a phase of hypokalemia, hypochloremia. Now because of loss of H plus ion, there is going to be an alkalosis. Now this alkalosis is going to be a metabolic alkalosis. Why metabolic alkalosis? Because the lungs are normal in this case. Now because of this metabolic alkalosis, body is going to try to compensate for it. Now how is it going to compensate? It is going to compensate by loss of HCO3 through kidney. Now as this bicarbonate ions are lost, during this sodium ions are lost along with it. Now because of which it is going to cause hyponatremia. Now we know that because of hyponatremia, this is going to lead to activation of the RAS system. This activation of RAS system is going to cause aldosterone liberation. Now this aldosterone liberation is eventually going to cause retention of sodium and water and excrete hydrogen and potassium ions, which is going to make urine rich in hydrogen ions and potassium ions. So as a result of which, the metabolic abnormality or the changes that we get over here are, I write it down again, hyponatremic, hypokalemic, hypochloremic, metabolic alkalosis with paradoxical aciduria. So this is very commonly asked in your vivas and your final semester examinations, and is definitely a potential MCQ in each and every exam, where you would be simply asked regarding the metabolic changes, which of the following is true regarding the metabolic changes of your gastric outlet obstruction. Thank you.